Good afternoon. My name is Grem. I'm an orthopedic surgeon from London, and I've been coming to Gaza for a few years, supported by the Department for International Development and by other charities. Our purpose here is to train Palestinian surgeons and to increase capacity for the treatment of injured patients. This is an additional trip because of the current emergency, and I'm hugely impressed by the resilience of the system for caring for the injured people. Since the 30th of March, there have been many patients injured with gunshot wounds, and last Friday we saw the system for looking after them in action. The system for what we call triage, for assessing the injuries close to the protests, seemed to be working extremely well. We were very impressed with the purposefulness of the people at what they call the trauma stabilization points, the way in which it was organized, the facilities which were available, and the way in which they managed both the many gunshot wounds as well as the gas inhalation injuries. The purpose of these trauma stabilization points is to reduce the number of patients that arrive at the main hospitals, and they've been very effective in doing that. Our other concern is the management of these injured patients at the major hospitals. On Friday we were based at Shifa Hospital, and there was a more or less constant stream of patients arriving from the border areas, from the protests, from the trauma stabilization points. And from my point of view, the organization for their reception, for their treatment, their surgical treatment and their subsequent management has been really exemplary. There are a lot of problems when you have mass casualties. The first of them is that each patient arrives with a large number of anxious relatives. So there is an element of what we might call crowd control, and that was done extremely well. Within the emergency room, the assessment was very quick and, to my mind, accurate and effective, so that patients with relatively minor injuries were deflected. Those with major injuries, their resuscitation was continued, and they were admitted within a few minutes. And that is a record that is probably not going to be matched in any emergency room anywhere. A quick, accurate assessment, and the directed appropriately either to minor treatment, but a large number required immediate operation. And to see people moving from the back of the ambulance to the operating theatre via a system of assessment in a very few minutes was, to my mind, a vindication of the planning and the resilience of the expertise of our Palestinian colleagues. So while I'm here to help, I feel that I'm learning as much as helping, and I both admire and respect the resilience of the system within Gaza for looking after the patients in this present emergency.
Your advice?